Well, number one, the community thing hasn't happened. I mean, they've centralized healthcare. So it's being quarterbacked essentially out of Edmonton.
That's right.
So it's distanced itself with community needs. So how will Edmonton know what Strathmore needs or Northwest Calgary and so forth? And yet, when we look at what Ontario's done with community health centers, and community health centers, by the way, have been around since about 1945-46. They started in Swift Current, Saskatchewan. I mean, there's another one that started up in Sault Ste. Marie, Ontario back in '65.
Yeah.
And I have to say that during the H1N1, that community health center is so well organized that the longest wait anybody had for an H1N1 shot was 15 minutes.
Right.
I mean, compare it to 8 hours, 9 hours here, and people had to go back day after day
right.
to get their shots. So community health centers, which have community boards,
yeah.
are the way to go, because it kind of focuses on health, not sickness. And one that stands out in my mind is a phenomenal community health center in Ottawa called the Sandy Hills Community Center. You need to Google it to see the amazing work these people do. And the focus is to keep seniors at home, to provide them with supports and so forth, which leads me to what's happened in senior care here. We know that in Alberta there's about 800 seniors occupying hospital beds, where what they really need are long-term care beds. And essentially hospital beds are costing taxpayers thousands of dollars a day versus long-term care beds, which are hundreds of dollars a day. So why our government would break the promise of building 600 more long-term care beds across the province? It's astounding that they would actually promise it and then cancel it and continue to have these seniors in hospitals rather than long-term care centers. That would alleviate some of the pressure in emergency wards. Imagine if all of a sudden 800 beds freed up in Alberta, then that would actually take some of the waiting times and reduce them in emergency wards and really free up those beds for people who really need them. Why the government wouldn't think long term and say, if we built these beds, we could actually do a lot of that and alleviate some of those pressures. It's beyond me. I would imagine it's purely ideology. They're not interested in it. They want to replace it with designated assisted living. And I mean, designated assisted living centers are way above what most seniors can afford.
Absolutely.
And it's a business thing, and as soon as you have profit in that, then your priority changes. And so what we're saying is, let's look at the best practices, and some of the best practices that I've read about were in Denmark. I mean, the focus is not on economic efficiencies for seniors, and they're not warehoused in these buildings of hundreds of seniors in them. The focus is on quality of life. Yeah. And I mean, these people seniors there are flourishing. They're not waiting, their last days, but they're actually living.
Okay, good. You repeat that part about Denmark.
Oh, I mean, Denmark has a focus on quality of care for their seniors. And I kid you not, the seniors are absolutely flourishing. They have smaller group homes for seniors and so forth. But the thing that stands out with Denmark too is that when a senior turns 75, they have a visit from a geriatric nurse. So, okay, what are how are you doing? What are some things you need? And they go right into the house. So not only do they get to ask questions, but they also view how people are getting along. Does a house have lots of stairs and so forth? Is it easily accessible to seniors in terms of, going outside and going into the community and so forth? And what they basically do is an evaluation, because their number one mandate is to keep people at home, because that's where people really want to be.